I'm Mabel Charles. Welcome to another interesting episode of Health Talk, where we have real talk and get real answers. Like I've said, there are two segments for Health Talk. First segment is Street Talk on Health, while the second segment is Health Talk. Today's episode's topic is the importance of medical imaging in healthcare delivery. Let's go to Street Talk on Health to know if they understand the meaning of medical imaging. Please do stay tuned.
Medical imaging. Yes, I've heard about that. I think one time I went for test. That was 6 months ago. I was able to, a body image was appeared in the computer.
Okay, that's the X-ray.
Yeah.
So you have a little experience.
I have a little bit because I don't go for it.
The kind of information for you to know the body system and how the positions of the bone, if they are actually in order or not.
Okay.
So to me, it's not much.
Yes, I've done it too because I have pains in my waist. Okay. There was a time I was having severe problems. And I got there, they said nothing is wrong with me.
Okay.
So then the doctor now prescribed some minor tablets for me to take. That was it.
And the pain was off.
Yes.
And some persons, when they tell them to go on X-ray, they will say, the X-ray light and stuff like that is always bad to the human health. How true is that?
No, it's not true because when I was working as domestic staff sometimes ago, before I was employed, I was asked to go for chest X-ray.
Okay.
And I went. So everything was, they did everything and everything was okay.
You're welcome back from Street Talk on Health. Still the topic, importance of medical imaging in healthcare delivery. We've heard what the street have to say and what they understand about medical imaging. We don't know all. So here with me is a professional medical practitioner, Kelechi Chijoke. You are welcome to Health Talk.
Thank you.
We've heard what the street have to say on the importance of medical imaging. What is medical imaging from your own perspective?
All right, thank you. Medical imaging is a technique and a process of making or creating visual representation of interior body parts and structures for clinical analysis as well as medical intervention of those organs and tissues.
Okay, so what is the role of medical imaging?
Okay. Yes, today medical imaging has grown, or diagnostic imaging has grown rapidly in the whole world, and it helps in different medical aspects and areas of medicine, which helps to simplify easy care of patients using those modalities in order for you to get what you want, maybe getting the accurate diagnosis without injuring the patient or without any harm on the patient.
Okay. So, what's the use of medical imaging?
Yes. The use of medical imaging. Medical imaging is depending on the type of modality that is being used, that is to be used anyway, because each examinations or each organs have different type of examination. It has its own procedure or names called, depending on the area of interest or the organs being asked. That is why before you can now specify.
Are there benefits of medical imaging?
Yes, there are a lot of benefits medical imaging in healthcare delivery today. Medical imaging have a lot of roles and a lot of benefits. One, medical imaging helps in discovering or diagnosing of those diseases that cannot be seen with your eyes. They help in better clarity of bone pathologies, because if you don't use X-ray, I don't know if you know where a particular part of the body or bone is being fractured. So there are a lot of benefits. Also, medical imaging, like using MRI modality, you can use it to assess the brain if there is any abnormality or pathology related. Examples like hydrocephalus, brain tumor, and some other related pathologies. Okay. A lot of benefits, as I said earlier, because medical imaging helps in showing those diseases or complications which cannot be seen with your eyes with the aid of different modalities.
Okay, so what's the importance of medical imaging?
Yes, medical imaging as a profession in all healthcare delivery. For you to get what you want in all health facilities, a lot of things have to be looked into. What are those things? What are those basic things we need as a medical imaging scientist? And what are the basic importance, just the way you have mentioned? Medical imaging helps in better bone clarity for better diagnosis. What do I mean by better bone clarity? Without the use of conventional X-ray or computed tomography imaging machine or modality, I don't think if one can ascertain or correction of bone treatment correctly. And also, medical imaging is very important because it helps in detection of diseases and pathologies which cannot be seen with your normal eyes. Medical imaging, depending on the modality used, are non-invasive, unlike ultrasound, ultrasonographic machine, and some other imaging machines like ECG. I don't think if there is any. Yes, there is none. No inversion, and there's no complication added.
All right. Okay, so another question is, are there mostly used imaging technology?
Yes.
The most ones that are being used?
Yes. There are lots of medical imaging modalities or machines used or types used in healthcare facilities to ascertain better delivery. One, we have a conventional X-ray. Conventional X-ray is a machine.
So you mean that different types of
Yes,
X-rays?
yes. No, different type of imaging modalities. Imaging modalities are different types of machines used in medical imaging.
Alright.
So how I was saying, as a conventional X-ray, yes, is a type of machine used in medical imaging department, in X-ray department, which converts electromagnetic radiations to X-rays. Are you getting me? To X-rays, and also it emerges as on the radiograph on the radiographic film, showing the organ X-rayed for better diagnosis and medical evaluation. We also have another different type of medical imaging modality, which we call computed tomography. What is CT? Computed tomography scan is an imaging modality which uses high ionizing radiations in treatment of or in diagnosing different body parts of the body to ascertain better clinical analysis. And it functions following a particular procedure or guideline or protocol. And the reason for the protocol is for managing the patients or to reduce high rates of radiations emitted on the patient to avoid damage of body tissues or cells.
Okay.
And this computer tomography machine appears in cross-sectional images, in slices. They come out in cross-sectional layers.
The X-rays?
Yeah, no, I'm talking about the computer tomography machine. Yes, image. It appears in 3 dimensions, which appears in the height, the width, and the depth. These 3 cross-sectional images appears on different radiographs, so for easy diagnosis. And emission being transmitted is being controlled by the technologists or by the imaging scientists who handles the machines to avoid much radiation dose to the patient in healthcare delivery. 1. We have conventional X-ray machine. We have computer tomography machine, CT scan. We have MRI, which means magnetic resonance imaging machine. we have ECG, which is electrocardiogram or echocardiogram, EEG or ECG. We also have mammography machine, and so many other types. The first one I mentioned was conventional X-rays, which I say is use of medical imaging machine, which has high electromagnetic radiations, converting it to X-rays in order to get a particular body part being requested by the doctor or a radiologist. 2. I'll talk of computer tomography machine. Computer tomography machine is a machine or imaging modality which use high ionizing radiation, which appears in cross-sectional image layers or cross-sectional layers or slices of body parts or organs asked. And computer tomography has a protocol or a guideline which must be followed before the procedure. Those procedures helps to reduce radiation dose to the patient. What do I mean by radiation dose to the patient? The radiation dose to the patients are those radio waves or radio rays that is being transmitted, which is not good for human health. So with the use of those guidelines, it helps to prevent lower radiation, minimum permissible dose the patient needs in the body to avoid damaging the cell tissues. It operates with 3 dimensions: the height, the width, and the depth. I also mentioned ultrasound or thermographic machine. Ultrasound scan or ultrasound machine or ultrasonography is a name given to high piezoelectric sound waves, which are over 20,000 cycles per second, and these waves are inaudible to human, is unharmful to human. Ultrasound machines can be used in different health diagnosis, and it is the most common as at now, which have no side effects in human health, but especially in diagnosis of pregnancy, multiple gestation, maybe and many other issues. Ultrasound machine as at now is the only machines which you can use in diagnosing pregnant women without any complication and detecting those complications which can come further.
Okay.
So to rule it out, you use ultrasound machine and also other internal organs like the liver, the gallbladder, the spleen, the stomach, and some other organs inside the other internal organs in the body. Also, I mentioned magnetic resonance imaging machine. Magnetic resonance imaging machine is a imaging machine. It's a type of machines which uses electromagnetic properties to operate. In this magnetic imaging machine or MRI machine, there are some things. Now there are some precautions you should take or you should be advised before going into such examinations. 1, you don't need to go into the MRI room with a metal object to avoid causing hazard on you or causing damage on man. And also, before the examinations, you should be briefed on how the procedure looks like, and so many other ones.
So
ECG, I mentioned ECG, electrocardiogram is used to check the heart positions and blood flow to the heart and the heart functions in general.
So are there side effects of medical imaging for the patient and the operator?
Yes, there are side effects if not managed well. That is why most times we brief you on how the examination looks
Is it
like.
a long-term side effect or a
It's
short-term?
not. It's just a radiation. Because
Okay.
irradiation, you don't see it with your eyes.
But radiation causes cancer. Am I wrong?
Yes, high rate of radiation emission on man's body
Okay.
can lead to cancer. That is why we have minimum permissible dose (MPD), minimum permissible dose a patient needs.
Okay.
Sometimes, to avoid damage of the cells,
Okay, so
because low damage or low cells can lead to maybe can make a man can make a man impotent.
okay.
That's why we have minimum permissible dose which a patient or a technologist should have, and it's calculated in REM. So that's why most times when carrying out these procedures, to rule out those effects, you'll be advised to follow the right procedures to avoid any hazard.
So it's only impotency and cancer that it can cause to the operator. What about the patient?
That's what I said. Both to the patient and to the technologist or the operator, the person who operates it.
Alright, let's take a short break, please. We'll be right back. Okay, you're welcome back from the short break. We're still on the importance of medical imaging on healthcare delivery. So, Mr. Kelechi, what's the other name for medical imaging? Are there any other name?
Yes, we have radiography.
Radiography?
Radiography, yes. But medical imaging is the summary of all radiographic procedures or medical imaging technologies. That's what we call them medical imaging, because the radiographers or radiography is also a part of medical imaging. Medical imaging is the summary of all the professions in that medical imaging.
So that's the most common name?
Yes, medical imaging. Medical imaging is the general name of radiography. Radiography is a part of medical imaging.
Okay.
It's a subdivision of medical imaging.
So the doctors that of medical imaging, what are they called?
They are called radiologists.
Radiologists. So you are a radiologist, right?
No,
You are.
I'm not a radiologist. And I'm a medical imaging technologist.
Okay, technologist.
Yes.
Okay, so they're different.
Yes.
Can you elaborate more on that, please?
Yes. We call ourselves technology because we know about most machines. There are some procedures we do that others people doesn't do.
Okay.
Yes, there are some that are being set apart for some professions depending on the one you know. But most of these medical imaging modalities are not being handled by one person. Some people have the area of specialization. Some will just say that I want to be doing X-rays and scan alone. Some want to be doing CT. They want to specialize on CT, MRI.
Are they doctors also?
Yes, they are all scientists. Depending on the area or the way of your choice, the one you choose more interest, the one you choose to practice very well.
Okay.
For you to ascertain or to give good health delivery or high diagnosis, you should.
So you specialize on the scanning and the X-ray, or
yes,
just
one can specialize.
generally?
For now, we are doing general, but no man is island of knowledge. You should keep on practicing, let your hand keep getting strong.
Okay.
The more you build yourself, the more you go forward.
Okay, so what medical imaging do not use radiation? I guess some don't use radiation, or
Yes. Yes. The one that doesn't use radiations, rather it's used waves to operate, is ultrasound machine.
that's for the scanning.
Yes, ultrasound scan machine.
Okay.
It doesn't emit any radiation, it's not inversion, it's very safe for everybody, for big and for small, for old.
So no side effects of
Yes, ultrasound
ultrasound.
doesn't have any side effect in a woman, and it's based on our global health challenges and global health in general. Ultrasound is mainly recommended for everyone. Why?
But it's mostly for the pregnant women.
It's not mainly for the pregnant women.
Okay.
Ultrasound has different areas that you use it for. Almost all areas of medicine you use
Ultrasound.
medical imaging. Yes, you use ultrasound. One, it helps to rule out many liver problems,
Okay.
because you cannot be going for liver problem using conventional X-rays, which can be done too. But to avoid any radiation emitted, or to avoid any harm, ultrasound is the safe and the best modality to be used as at now on human, especially both pregnancy and not pregnancy, but that is the only machine which you can use to dictate if there's any multiple gestation.
Okay, so can we talk on medical imaging modality, a little bit of it?
Yes. Yeah, I think previously I've mentioned different type of imaging modalities, which are conventional X-ray machine, computed tomography, scan, magnetic resonance imaging machine, ultrasound machine, scan, ECG, electrocardiogram machine, or EEG, echocardiogram machine, and also mammogram. And other imaging procedures like HSG, which means hysterosalpingography or uterosalpingography.
Alright, so those are the modalities.
Yes, those are the medical imaging modalities, and other nuclear medicines, which are all part of imaging modalities.
What's your recommendation on medical imaging?
Yes. So the viewer, I thereby recommend all these imaging modalities, most especially the ultrasound scan, for better diagnosis in all health facilities, because it's very safe and unharmful to human. Thank you.
Okay, thank you for coming down to the program. We appreciate, and for that we have the bone pillow where you can sign as a reference that you were on this program. So yes, you write your name, sign anywhere you want.
Anywhere?
Yes, anywhere. Your name and your signature.
My name?
Yep. Okay. All right. Okay. Thank you so much. Okay, yeah, we come to the end of the interesting and exciting episode on the importance of medical imaging on healthcare delivery. For sponsorship, for advert placement, email is on your screen, healthtalknig@gmail.com. For social medias, you can check the screen also, Facebook, Twitter, and Instagram, Real Health Talk. And I want to appreciate the Festive Entertainment for making this production successful, and for my makeup, appreciate Alora for making a very wonderful makeup for me, and I appreciate Eden Lounge and Restaurant. Thank you for watching, and thank you for staying with us.